800 military and other federal emergency personnel have been deployed to 24 states, tribes, and territories, including over 350 military doctors, nurses, and medics, helping staff the hospitals who are in short supply. This is on top of more than 14,000 National Guard members that are activated in 49 states. These deployments in my direction, and thanks to the American Rescue Plan, are fully paid for by the federal government. We've shipped over 5.5 million pieces of personal protective equipment, gloves, gowns, masks, to protect frontline healthcare workers. We're shipping more treatments of COVID-19, which includes antiviral pills, than at any point during this pandemic. In addition, I've directed Fema to work with every state, territory, and the District of Columbia to make sure they have enough hospital bed capacity. Today, I'm announcing our next deployment of 6 additional federal medical teams, a total of more than 120 military medical personnel, to 6 hard-hit states: Michigan, New York, New Jersey, Ohio, Rhode Island. And let me close with this. It's been a long road, but what's clear is that we get through this when everybody does their part. No matter where you live, no matter your political party, we've got to fight this together. Unfortunately, while the military is stepping up, as they always do, there are others sitting on the sidelines, and we're standing in the way. If you haven't gotten vaccinated, do it. Personal choice impacts us all, our hospitals, our countries. I make a special appeal to social media companies and media outlets. Please deal with the misinformation and disinformation that's on your shows. It has to stop. COVID-19 is one of the most formidable enemies America has ever faced. We've got to work together, not against each other. We're America. We can do this. So the military medical teams on the ground, thank you for all and everything you're doing. And I'll stop here so we can get to the briefing started. Thank you for taking the time.
Mr. President, can you have a message for vaccinated Americans who are wondering why they should continue to restrict their activities, given that your health officials say most Americans will get COVID at some point?
Folks, we'll talk about that later. Come on. Let's go.
Why should Americans trust your administration to beat COVID when the virus is clearly
Mr. President,
winning?
on voting rights, do you think the Republicans would don't support voting rights?
The virus is clearly winning, sir. Why should Americans trust
Thank you,
you?
President. Appreciate you. Thank you so much.
Mr. President, do you believe Omicron is the beginning of the end of this pandemic?
Thank you so much, President. Thank you, President. Thank you
How
all.
much longer do you think the school kids will have to wear masks, sir?
Thanks, everybody. Appreciate you.
Maybe a press conference soon, Mr. President. We look forward to that.
Me too.
All right, we'll go back. So thank you.
We'll start in 1 minute. All right. Mr. President, we'll start with Administrator Criswell, whose team at FEMA, as you know, has been on the front lines of the COVID response. Over to you, Administrator.
And everything else.
A lot going on these days, Mr. President. Thank you, Jeff. Mr. President, as you know, FEMA has been working the COVID mission since day one. Our objective has always remained the same: to protect and save as many lives as possible. During every disaster, FEMA's strength is our ability to coordinate with other stakeholders, with our federal partners, with our state partners, with private and nonprofit partners.